All right, so thank you for those tallies, and do get yourself seated for more domestic coverage, which will begin with my colleague Shin YE-EUN. Yan, welcome back.
Glad to be here, Sunny.
Right, so I hear authorities are bracing themselves for greater record highs, that is, in COVID-19 fatalities in the weeks ahead. Let's start with this, Yan.
Sure. So just yesterday, which would be a Thursday, we saw the highest number of deaths in a 24-hour span at 470. On this Friday, the tally fell by roughly 80, but still marked the third highest figure at 393. We have to also keep in mind that COVID-19 deaths are a lagging indicator of infections, and that our daily tallies hovered in the 200,000s in the first week of March. Recently, the figures have stayed above 300 or 400,000, and we also saw a record number of infections last week at over 620,000. This may indicate that Korea could see double the number of deaths in the coming weeks compared to now, with over 1,000 daily deaths. And some experts have also suggested that our actual death toll from COVID-19 could actually be 2 or 3 times more than the government's official tally. Now, this could be owed to a number of factors like COVID-19 patients who die from health complications after testing negative for the virus and being released from quarantine. But the government has maintained that Korea has a low fatality rate at 0.13%. Authorities insist that its official death count is accurate and includes fatalities resulting from underlying health conditions. But at the end of the day, both health authorities and experts say those at high risk need to be treated effectively.
Meanwhile, Yan, the Prime Minister here believes Korea is past the worst of the Omicron wave.
That's right, Sunny. Earlier this morning, Prime Minister Kim Boo-kyum said Korea's Omicron surge appears to have been tamed to a certain degree. Take a listen to what he said.
Compared to last week, we're seeing 50,000 fewer infections each day on average. Though we still need to see whether this downward trend will continue, I think we can say that we're getting over the hardest part.
The Prime Minister cautioned, though, that more efforts are needed to reduce the number of deaths and severely ill patients. As part of that goal, he shared the government's plan to distribute more antiviral pills. For weeks now, our supplies of antiviral pills have been running low, as some 7,000 courses of Paxlovid are being given out each day. In response, authorities have decided to take delivery of Paxlovid shipments contracted for April earlier than planned. Today, we saw some 44,000 courses of Paxlovid arrive in the country. Officials are also in the final stage of securing more deals. And also, a new oral pill, Lagevrio, is to be given out from Saturday, some 100,000 courses of them, in fact. And this pill, made by Merck, is the second one of its kind to receive the green light from the country's drug regulator. They will be used on seniors age 60 and up, or those age 40 and up with underlying conditions, and the immunocompromised at high risk of drug-to-drug interaction related to Paxlovid. But pregnant women and children under 18 will not be eligible.
Moving on to the inoculation front here, registration for those aged 5 to 11 started on Thursday. Vaccine registrations, of course. How are parents responding?
Well, the majority of parents don't want their children vaccinated, at least not at this time. Health authorities conducted a survey on some 359,000 parents with children in an elementary school to ask whether they were willing to vaccinate their child, and 6 out of 10 said no. Most parents said they wanted to test the waters and wait for more related studies on vaccination for young children, and experts said this type of information should be disclosed transparently. Actual vaccinations for this age group, meanwhile, are set to kick off on March 31st.
Right, I see. And staying with vaccinations, so a new study from the UK suggests that booster shots are quite effective for the elderly.
Right. More widely recommended than for children, of course, is the vaccination campaign for the elderly, with booster shots having become the norm domestically and abroad. Now, fresh data from the UK's Health Security Agency on Thursday showed an effectiveness against hospitalization among people aged 65 and above by 85%, 15 weeks, so almost 4 months after receiving an extra dose of COVID-19 vaccine. 2 weeks after their third one, efficacy was estimated at 91%. The study is based on calculations of people who were hospitalized primarily due to respiratory problems and tries to distinguish between people who were admitted to hospitals due to COVID-19 and those who had an illness and tested positive for the virus in routine checkups. It's the first such data released in the UK on the longer-term prevention of boosters. The country is using Pfizer and Moderna vaccines for its booster campaign.
And speaking of the elderly, experts have also called on nursing homes to better exercise management and prevention, as 1/3 of our deaths have come from these venues. To aid their efforts, authorities said they will prescribe more antiviral pills and put more effort into treating COVID-19 patients with underlying conditions. Authorities believe that this particular group is at very high risk, who require constant care and monitoring to treat chronic illnesses rather than just COVID. On the testing front, authorities have been discussing whether to stop handing out rapid antigen tests at screening centers nationwide. Most regional governments are supporting this move in hopes that medical staff working at these screening centers can be reassigned to focus on treating patients instead. Now, if discussions go as planned, this change could take effect from April 4th. Now, this is also when the country is widely expected to further ease social distancing restrictions.